everyone, welcome to the first chapter of my mini-series on surviving your hospital stay. I've been a nurse for a few years now, and it feels like I've worked with thousands of patients. Some were prepared for their hospital stay, but many others were not. Whether it was the anxiety of being in a new environment, being unfamiliar with the hospital's procedures and schedules, or being poked by needles at 4 a.m. It made their hospital experience that much harder than it could have been. So in this mini-series, I want to share with you insider tips and tricks. I'll be covering everything from what to pack, to your rights as a patient, to IVs and blood draws. Everything you might encounter during your stay, and how to get through any bumps in the road. So click the button to subscribe to my channel, because every Monday at 5 p.m. I will be posting a new chapter on surviving your hospital stay. Chapter 1 is what to bring with you to the hospital and my explanations for why. Maybe you're going to the hospital for surgery, or maybe you're having an exacerbation of a disease process that requires you to be admitted and stay in the hospital for a few days. This video will go over the essentials to pack so that you are prepared, and to make your admission smoother. There are a lot of packing lists on the internet for when you're having a baby, but this packing list is for hospital stays when you are not having a baby. I want to start by going over some of the ways you could end up being admitted to the hospital. So first is you're at home and something happens, maybe a heart attack. You go to the emergency room and maybe undergo a procedure, but you ultimately stay for a few days. A lot of people come in the second way. You have a planned surgery, like a hysterectomy. You come in the day of surgery, recover, and stay a few days in the ICU or medical or surgical unit. Sometimes, though, it is an outpatient procedure, but the surgeon would feel better if you stayed for a night instead of going straight home after surgery. You could be admitted that way too. Third way is through the doctor's office, maybe doing a follow-up or a checkup, and the doctor notices your blood counts are low or your kidney numbers are too high. Whatever it is, you go from there to the emergency room and then the floor. And the fourth doesn't happen a lot, but you can go straight from home to the floor. So you can see that most of these admissions are unplanned. So it's a good idea to have a bag that's always ready, especially if you have a disease that necessitates frequent hospitalizations like asthma, or you're undergoing treatment for cancer. So obviously, sometimes there's just not enough time to pack, and that's okay, because the hospital stocks all of your essentials. Depending on what floor you're on, a medical surgical floor might have some more things available than, say, an intensive care unit. So most hospitals have the toiletries you'll absolutely want to have, toothbrush, toothpaste, soap, lotion, and mouthwash. And then they might have cups for your dentures, a small comb, razors, disposable underwear, sanitary pads, socks, and then a lot of floors stock games and books and magazines for your entertainment, and a lot of rooms have TVs. So what should you pack? I've divided the packing list into 4 categories. The essentials, or what you really need to take, things for your comfort, things for your pleasure or entertainment, and things you want to bring to speed up your admission process. Now, essentials. Technically, you can go to the hospital with absolutely nothing and be fine, because you saw everything the hospital has on the last slide. And I've had patients come in from the ER with just the clothes they were wearing. So by essentials, I mean the things that I would absolutely bring if I knew I was going to the hospital. First is a set of clothes to go home in. Once you're admitted, you're asked to change into a hospital gown, so you don't need to bring an outfit for every day of your stay. Just some street clothes to go home in. And I've had patients leave in their hospital gowns, but security in the lobby ask questions when they see patients walking outside and getting into cars with the gown on. A list of important phone numbers. If your phone dies, you forgot your phone charger, the lost and found box doesn't have any USB-C chargers, you're going to need to use your room phone to call your mom, your only son, your daughter-in-law, your 5 daughters, your wife, your granddaughter. Now, when you're admitted, The nurse will take down the name and number of your primary and secondary contact if you have one, so there will be a number in the chart that you can ask for. But let's take this list of phone numbers just in case. I include medication list and medical and surgical history list in the speedy admission category, and I'll talk about them more there, but I put them in the essentials category because people who go off of their memory often forget the name of the surgery they had 10 years ago. They might only remember the color of the pill and not the name or dosage. So make a list and update it when things change and bring it with you. It is in your best interest to be very thorough, especially with your medications and allergies, to prevent serious drug interactions. I also want to warn you here that some hospitals are not using one electronic health record database throughout the entire organization. So, the resident on the medical floor might ask you the same question as the nurse in the ER. When this happens, you might get frustrated and feel that no one knows what's going on. This is not true. Also, your attending doctor might have already asked you the same questions that the GI or kidney specialist is asking you right now. Again, you might feel like you are repeating yourself, but the truth is, everyone wants to hear from you, the patient. They want to double check and verify what they already know with the patient, who is the expert on their history and symptoms. A lot of times, patients recall things better on the floor than they did in the emergency room, and they can tell the floor doctor what they forgot to tell the ER doctor. So my message here is to try to be patient and answer questions as best as you can. The doctor's goal is not to frustrate you, but to find out more about you so they can help you. And finally, don't forget your ID, some cash, and your health insurance card. Most hospital rooms have safes where you can create your own passcode to open it, and you can keep all of your important belongings in there when you're not in the room. Before I get into the 4 comfort and entertainment lists, I want to remind you that you're going to the hospital for a serious medical condition. Your main goal should be to get better and get back to the comfort of your home, especially because the hospital is full of sick people, contagious people, and bacteria, despite constant decontamination. So for your comfort, don't forget your charger. It seems like everyone needs a charger, and we have every single charger that someone left behind except the one you need. So try to remember your chargers. Or you can just disconnect for a few days and take the time to focus on yourself and getting better. Some people can't stand the hospital gowns. They're stiff. They open from the back and show your butt. They're too big, they're too small. So some might insist that they wear their own clothes. This is not recommended because the gown allows for easy assessment of incisions, drains, lung sounds, etc. You're most likely attached to IV fluids or some sort of tubing as well. Gowns have buttons and pockets and holes to accommodate these. And gowns allow for quick access if we need to perform CPR or any emergency procedures. But if you just can't do it, bring clothes that are loose, like large t-shirts and sweatpants. Also bring loose underwear if you have to, so that the elastic doesn't dig into any incision sites. Many patients bring robes to wear over their gowns for warmth and to hide their butts when walking around. This is fine. Hospitals have socks for everyone. They have rubber on the bottom to prevent slipping and falling. If you want to bring your own, make sure that they are non-slip, or bring non-slip slippers or tennis shoes. I added chapstick because hospitals are very dry, and pillows because hospital pillows aren't comfortable. Also, if you had surgery, you can use the pillow as a guard between your incision and the seatbelt for the ride home. I told you that the hospital has toiletries, but you might want to bring your own, like your favorite brand of shampoo and conditioner, your own denture supplies, a brush for your hair, and lotion you like to use. And for your entertainment. When you're not having visitors, you're done all of the physical therapy and procedures scheduled for the day, the doctors have finished their rounds, and you don't want to watch any TV, bring some books, word searches, coloring books. Some floors have games and magazines you can borrow. Finally, here are some things that make the admission process easier. And by easier, I mean faster. Know your last flu and pneumonia vaccination, especially during flu season. Hospitals try to get everyone who didn't get it yet, and they ask every patient. You can refuse it. Medical history also includes any disease processes you might have, like diabetes, hypertension, high cholesterol, GERD, or arthritis. And you don't want to leave anything out. A lot of medications react with a lot of different things that we give you in the hospital. So a very thorough outline of your history will help us prevent avoidable complications. Your medication list should include the name, the dose, frequency, and the last time you took it. For allergies, write down what it is you're allergic to, especially medications, and exactly what happens when you take it. It is helpful if your surgical history is in chronological order, but not necessary. I recommend typing all of this up and keeping them updated, and then making copies. Bring at least 5 copies with you when you go to the hospital. Then you can just hand this paper to whoever asks you for your history, instead of trying to remember everything off the top of your head. Trust me, this makes the admission process go so much faster, which allows doctors to put in their orders faster. Thank you guys so much for watching Chapter 1 of the Survival Guide. I hope this was helpful to you. Please leave any questions you have about your upcoming or past hospital stays in the comments below, and I will be happy to answer them or include them in future videos. Don't forget to subscribe, and I'll talk to you next Monday during the next chapter of Surviving Your Hospital Stay.